Well, ladies, have you gotten your mammogram yet? We're going to talk tonight with radiologist Dr. Elizabeth Darville as part of the information sharing as we observe Breast Cancer Awareness Month. Dr. Darville, welcome to the Bahamas tonight. Thanks so much for joining us.
Thank you.
Well, we heard that heartbreaking story of this young woman just in her early 20s already dealing with breast cancer. As we talk about mammograms, the standard test for any abnormality in the breast, how has the age requirement changed for that in terms of the youth of people who need to be tested and as far as Bahamians go as well?
The age requirement hasn't changed. The age requirement is decided by your family history. The lady you spoke about just before this segment, she's 25 years old. And she has had breast cancer. She's 25 now, so she was probably diagnosed when she was 24. But her family history suggested that she had to be screened earlier. And so you have to be very aware of your family history and your risks, and then decide when you're going to start your testing.
Now, age 25, besides the family history, are there other contributing factors? Are those numbers rising in young people, younger and younger people?
In the Bahamas, we have, well, we don't know how many, but we have families who have the BRCA gene, so BRCA gene 1 and BRCA gene 2. And the people who have this gene, they are far more susceptible to getting breast cancer. In fact, your risk reaches something like 75% in your lifetime to develop breast cancer. And this is probably why that young lady was advised to have both her breasts off. If you know that your family is BRCA positive, then you must start much earlier than a family who is not affected.
And I started to ask you earlier, but what do the statistics say about Bahamians and breast cancer and other types of cancer for that matter?
Our statistics are very thin, and we go on anecdotal things that we share in the medical community. But in the world, we're probably number 1 or number 2 as a population for breast cancer. There's a Jewish population who is just ahead of us or just behind us, but we are number 1 and number 2 in the world.
That's staggering. What do you tell women who present with a lump or who have a family history? You see these women from day to day. What advice do you give?
Well, the advice that you give everyone is that you should get screened before you find a lump. Because by the time you find a lump, you may be at stage 2 or maybe even 3. The ideal situation is to find the cancer before you can feel it. By the time you can feel it, it may have already spread to your lymph nodes. So it is better to just go and have your testing done before you have any symptoms at all.
All right. And no better month than now to
get
that done. Thanks a lot, radiologist Dr. Elizabeth Darville sharing with us tonight.